So today we're going to have a look at a patient who has an impingement syndrome in the AC joint that was damaged during a weight lift. So many times when people are lifting weights, the weight will either become unstable or through overexertion, they develop an impingement between this bone here and this back shoulder blade, which forms this AC joint. You see that this particular patient, the spine is rounded forward, a bit of spasm here on the right side as the scapula is dysfunctional trying to pull away. So it's important as we correct the shoulder that we look at the thoracic spine as well. Now we're going to start the process of correcting the thoracic spine. Shoulder in the joint. All right, now we're going to do a posture correction to get rid of that rounded area in his mid-back. Take the tension off of the shoulder blade and to help him be able to stand up straighter. Hold it all the way out. You see the curvature in the mid-back is far less than it was in the initial encounter. The spasms here in the shoulder blade have gone down as well. And if you have the patient lift his shoulder up from the side, right? Now the range of motion is greatly increased, the pain will be overall reduced. We're going to do a little bit of cold laser therapy right in here, and that should help complete his visit for the day.